are seeing the effects of not being able to access health care in the families and the children that they're working with. And so it's a really important issue for us to be able to provide health care for those families and children.
So what are we seeing? More families having to take a trip to the emergency room and overall costing everyone more money?
Yes. So the emergency room has become the primary care services for a lot of those families. And the cost of an emergency room care can be over $900, where to go see a primary care visit is 6 times less than that. So what we're looking at is how do we alleviate those costs, which impacts the clinics, the county, and the hospitals in an impactful way as well. So if we could reduce those kinds of costs, it would make such a difference for those families.
And undocumented families, how many people are we talking about that could possibly benefit from having this health care coverage?
Well, in Sacramento alone, there's upwards of over 50,000 undocumented residents. We're still looking at the numbers to determine, how many will be impacted by this program, but hundreds, thousands of families will be impacted by having a program to support them.
Okay, and as we go on before the Board of Supervisors, are you anticipating some fierce opposition to this issue?
We anticipate there will be some, and we understand that, but we also understand the greater need is that our families need support and they need help. They're residents in this community. They work hard in this community. They need to be able to access health care and services so they can be and provide for their families as well.
Okay, and we're talking about the pros and cons. What would be one of the cons to this?
Well, the cons would be, for me, I'm not sure what the con would be because I feel like everyone deserves health care. But there's a cost factor to it, of course. And so how to work through those things and working with the county to figure out a solution is definitely going to be the issue.
So exactly how many funds do you think would be necessary to restore a program to where it could keep going year after year?
Well, we've been looking at several different options, and the county's been looking at different options as well. And so it's really looking at what's going to be available in the budget, and then what's going to be an option that's going to make the most sense for the county as well as the residents and undocumented folks that are living
And
there.
lastly, what would you tell the Board of Supervisors when looking to take up this issue on Wednesday?
Well, just to look at, make sure that these are folks who are living in your county and who are contributing to the county, and they need the support, and to work with us to find an option that's going to make sense for everybody and benefit those children and families.
Okay, Cam Williams, thank you so much for joining us and taking the time to explain this issue.
Thank you, and thank you for having us.
Okay, of course. And today, health leaders are hosting